Good morning. I'm Dr. Chris Nevin-Woods, Medical Director at El Paso County Public Health, and I'd like to talk about the flu season, influenza, and the vaccine. First of all, just to go over a few things about flu seasons, is that they generally go from about October to May, as you may notice. Usually peaks in January on the average year, but every flu season is different. And it depends on the flu viruses and their types that are circulating at the time, and also depends on the match. How good is the match between the vaccine that year and the virus that's circulating? And we also know that flu viruses change, and they can genetically change very quickly, and they're constantly changing. So whether we have a mild or a bad year often depends on those factors. Also on the uptake of the vaccine in the community, how many people are getting vaccinated. So looking at deaths, which is our worst outcome from influenza, vary from year to year, and then in general it goes from about 3,000 deaths in a year to 49,000. So it's going to depend on how severe the disease is that year, and the majority of deaths are with seniors. So far we've had 2 hospitalizations in El Paso County in adults. We're off to kind of a slow start, which may be a good sign. And however, CDC is somewhat concerned that we may have a severe year this year, and the doctors have been getting notices on that. So let's talk about vaccines. We need a yearly vaccine for influenza, and you might think that, well, we have other vaccines that we can get once in a lifetime or every so many years. Well, influenza vaccine changes every year depending on what viruses are circulating. And the vaccine lasts about 6 months, which covers generally the season. It's best to get vaccinated by the end of October, but it's really, because it takes 2 weeks to build protective antibodies against the virus. So it's a good idea to get vaccinated before the season starts. However, I like to say it's never too late, because we never know how long the season's going to last. And there are many options, and there are some changes this year. CDC only recommends injectables this year. As you know, there's been a live attenuated vaccine that's a nasal spray we've used for a couple of years, and children love it and their parents love it. However, the last 2 years it showed low effectiveness, so it's not recommended this year. This year, vaccines have been updated to hopefully a better match. There's some new vaccines on the market and new recommendations for egg allergies. So just briefly, we have trivalent, which are 2 A's and a B subtype in the vaccine, quadrivalent vaccine available with 2 B's and 2 A's, high dose, and what's called vaccine with adjuvant added, which is for seniors. And what these do is help the senior be able to have a better response, immunity, and antibodies to fight the infection. We have a vaccine for those that are needle averse. I happen to have one daughter who fits that category. And it's intradermal, so it just goes into the skin. And also you can use jet injectors. Anybody who's been in the military over the years, you know that we've used those over time where you line up and go boom, 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 boom. But with these jet injectors, sometimes you don't even know that it's happening. So for the needle averse, that's helpful. We have an egg-free vaccine for those that are allergic to eggs, and recombinant vaccine where there's no flu virus used at all in the production of the vaccine. And some people feel very strongly about their fear of getting the illness or getting influenza from the vaccine. So I wanted to address a couple of concepts in this regard. And the first one is a misconception that I can get the flu from the vaccine. And this is very prevalent in recent years, and many people don't get vaccinated because of this fear. So I just wanted to go over what really does happen. It's possible that you got exposed and developed influenza maybe over the 2 weeks that your body's trying to build the antibodies after you got vaccinated. So that's possible. It's not as likely. You can have some symptoms with the vaccine as your body has the virus in it and you're building antibodies. So if anybody's had yellow fever vaccine and has traveled, you know you can feel pretty awful with that vaccine. Flu vaccine is a lot less, but yes, you may get a few aches and maybe even a low-grade fever. It doesn't mean you have influenza. It's your body fighting and building up antibodies. And it's important to know that the vaccine is not perfect. There isn't any vaccine out there that's 100% effective. And it may not prevent any or all disease, but the concept that's so important for us is it prevents severe disease, hospitalizations, and deaths. So individuals might get some symptoms, but it's really good at preventing these severe outcomes. There's some protection, even in low match years, and we know that the virus can genetically shift and change very quickly, but still usually there's some protection. And there's the ability of the vaccine to protect depends on various factors, such as your age and your health status. It doesn't work as well for people who have chronic diseases, such as heart disease, COPD, emphysema, those who have diabetes. As we get older, it's harder for our body to utilize the vaccine as well. And also babies who are less than 6 months can't even get the vaccine yet. And those of people who are on Humira and who have rheumatoid arthritis, immunosuppressed individuals, have cancer, they don't do as well with the vaccine. So that, I'd like to move on to the last concept is that herd immunity. You've probably heard of that, where those of us that have protection can protect those that are most vulnerable. And so the more people that get vaccinated, the less flu virus is going to be circulating, and this herd immunity can help those that need it the most, that are most vulnerable, protect those that are at highest risk. So the high risk who may not be able to mount a good response to the vaccine. And again, those might be babies under 6 months who can't get vaccinated yet, pregnant women, those with chronic disease, seniors, and those that are immunosuppressed. And then lastly, the concept that when we get influenza, we can be infectious a day or two before we have any symptoms. Meanwhile, we're walking around spreading the virus. So I'd like to give you an example of kind of my worst case scenario situations. Let's say you're at work, you're busy working as commissioners, and as the day goes on, you say, I have a little headache. I just don't feel my best. I must have stayed up too late. So I'm going to go run to Walmart and get some Advil. And you're in line in a very busy Walmart to pay for your Advil. And you happen to turn around, and there's a mom with a tiny baby. And you go, oh, what a precious baby. Congratulations, and you're within a foot of that baby. And, well, darn it, you may just be infecting that baby right then and there. And then as you're walking out of Walmart, you meet a senior that is in your district, and he comes over and says, hi, I want to thank you for all the hard work you're doing. And you're going, well, you're very welcome, and you're infecting that individual. So just to comment that how important it is that one, we get vaccinated, and two, we help protect those that are most vulnerable. And as a physician and doctors, we know that I've seen babies on ventilators with influenza. I've seen people die in the hospital, and it's tragic. So everyone, if we can just get our flu shots this year. And this concept is also why there's mandates for healthcare workers to have flu vaccine. And there was a lot of uproar about it a number of years ago, but it's important, because the last thing you want to do is work in a hospital and work in the nursery and infect those babies or somebody that's on the cancer ward. So I'll end with that, and if you have any questions for me.